The pulse is the rhythmic expansion and contraction of an artery as blood is pumped through it by the heart. Generally, normal heart rate during resting is 60 to 100 beats per minute. Very fit individuals may have an even lower heart rate due to their efficient heart. The human pulse should be easily felt clearly when pressing lightly on the radial artery on the wrist. If we consider what is optimal, generally the pulse is closer to 60 the better, meaning better heart health. A fast heart rate does not always indicate heart pathology. It can be toward the upper end during stress, anxiety, dehydration, fever, or early signs of cardiovascular strain. If we define normal pulse strength, a normal pulse should feel neither too weak nor excessively forceful. A very forceful pulse may indicate anxiety, fever, anemia, hyperthyroidism, or aortic regurgitation.
A weak pulse suggests that it feels faint or is difficult to feel consistently, usually because of low blood pressure or a blood vessel problem, or during shock or severe dehydration. We will discuss 7 most common pulse types and their causes. A fast pulse is the most common, which is when the pulse is more than 100. Generally, children have a fast heart rate, normally because of their small heart and faster metabolism, and it is normal in many cases, but rarely exceeds 100. The most common causes of a fast pulse are stress, anxiety, fever, dehydration, hyperthyroidism, smoking, and caffeine. If it is caused by diseases, we should suspect arrhythmias, like atrial fibrillation, most commonly. If a person already has heart disease, a fast heart rate can be caused by heart failure. If a person has chronic bronchitis, it can be due to lung problems. A lack of oxygen causes a fast heart rate, while a slow heart rate may be a sign of arrhythmias or be normal in athletes and physically fit individuals. Sick-sinus syndrome is common among older adults due to aging and inability to generate regular heart rate signals or atrioventricular blocks. It usually happens also among people who have heart disease when the electrical conduction between the atria and ventricles is impaired.
Impaired electrical conduction between the atria and ventricles, ranging from first degree to complete heart block, slows the transmission of impulses, resulting in a slower ventricular rate. Hypothyroidism also causes a slow heart rate, which generally reduces the metabolic rate, including the heart rate. Also, medications like beta blockers and other anti-arrhythmic medications commonly cause a slow heart rate. Also, myocardial infarction can cause a slow heart rate, particularly those involving the inferior wall of the heart, which may damage the conduction system, resulting in bradycardia. To measure heart rate properly, common spots are the inside of your wrist, radial artery, or the side of your neck carotid artery. Use light pressure. Gently press with your index and middle fingers until you feel a steady beat. Count the beats. Count the number of beats for 15 seconds. Calculate beats per minute. Multiply that number by 4 to get your pulse heart rate per minute.
The third is when the pulse is irregular. It means when there is no discernible pattern or rhythm. The patient may describe it as a fluttering or skipping sensation with no regular timing between beats. The most common cause in this case is atrial fibrillation, in which the atria contract chaotically, leading to unpredictable impulses reaching the ventricles, resulting in a completely erratic pulse. Premature atrial contractions and atrial flutter can also cause an irregular pulse. If the pulse is irregular but exhibits repeating patterns, for example, a skip beat every few beats, it is usually due to premature atrial contractions or premature ventricular contractions. Another pulse type is pulsus paradoxus. It means when the pulse weakens during inspiration. Generally, systolic pressure decreases during inspiration normally. The range is less than 10 mm mercury. However, in the case of pulsus paradoxus, systolic pressure during inspiration decreases by more than 10 mm mercury. Severe asthma and COPD exacerbations cause such a pressure. Increased intrathoracic pressure during labored breathing can impede illness return, leading to a marked drop in blood pressure.
Also cardiac tamponade and pericarditis, cause it when fluid buildup in the space around the heart occurs. The fifth pulse type is pulsus alternans. It happens when strong and weak beats alternate despite a regular rhythm. It is most commonly caused by severe left ventricular dysfunction. In the main pumping chamber of the heart, the left ventricle is significantly weakened. This is often seen in advanced heart failure. The sixth common type of pulse is a bounding pulse, also called a water hammer pulse. It occurs when the pulse feels exceptionally strong and forceful, and with a rapid fall-off. A common cause is a GERD, regurgitation, and hyperthyroidism, and sometimes exercise. The mechanism is a wide pulse pressure when the difference between the systolic and diastolic blood pressure readings is high. The seventh is a thready, weak when the pulse is very faint, weak, and difficult to feel, and often rapid. It occurs due to shock, blood loss, severe infection, or heart failure. Also during severe dehydration or conditions causing very low cardiac output, the amount of blood the heart pumps per minute, and or low blood pressure, hypotension, leading to a narrow pulse pressure. The body may also try to compensate with peripheral vasoconstriction.
Narrowing blood vessels in the limbs, which can make the pulse even harder to feel peripherally. It signifies significantly reduced blood flow or pressure in the arteries. And another type of pulse is pulsus bigeminus. It is a rhythm where every normal heartbeat is followed by a premature beat, leading to a pattern of two beats occurring in quick succession. It suggests the presence of premature ventricular contractions, PVCs or other arrhythmias, and it can be a marker of underlying myocardial irritability.